Hello once again and welcome back to my YouTube channel. My name is Alot and I am a physical therapist. In today's video, I will be showing you some of the tools that we could use in order to get rid of those tensions here on your neck, on your upper back, and some of those what we call knots in there that might be giving you so much tension, headaches, and it makes you feel like it's really heavy burden on your upper back, probably because of that faulty posture that I was talking to you about from the previous video. So if you are new to this channel, please consider subscribing, as most of the videos that I am posting is part of a series. And you may also hit the notification bell so you wouldn't miss any of those videos. So let me just show you quickly what are some of the tools that I am talking about. The first one is a good old tennis balls. Don't know if you can see it. So I'm gonna show it to you. How are you gonna use this one to release that tension on your neck part and on your upper back as well. The second one is this. This is, I don't even know what that is. Pressure point back number. Well, it just says what it is. But I know I just call this as like tension releaser. This is a very powerful tool because you could do this by yourself and you could reach pretty much like anywhere on your back. I have recommended this to a lot of my patients. Not necessarily what kind of brand though, but anywhere for as long as it looks like this, you're good. And then the last one is, sorry, it fell. What we call the massage gun. I was even scared that it fell off. So we have just, it's not that recently that we have used this, but we have been using this to a lot of our patients, especially if we could not put them on the waterbed. How I wish I could show you what the waterbed is, but I am going to show it to you later on when I'm in the clinic. But this one, certainly we could do the part. Okay, so I'm so excited to show it to you. You probably don't have this one yet, but I'm telling you, it is so much. Just shut this off. It is really worth getting this one. I've recommended this to the patients as well. Just let them know where to find it. Not necessarily have a good brand, whatever brand that suits you well. I just let them know. They get the treatment in the office, in the clinic, and then, teach them how to do it, and then they get one for themselves, okay? I'm not promoting anything, no brand, whatever not, but this is a tool that is highly used now in physical therapy as well as in massage therapy, okay? So, let's get on. Okay, the first one that I am going to show to you is this guy. We call it the pressure releaser, the tension knots releaser, the pressure point releaser, or simply the knots releaser. Okay, so you can see there is a narrower gap in here and there is a wider gap in here. I use the wider gap for the lower part of the back and then the narrower towards more the upper back. Okay, I'm just going to show it to you at an angle so you could see exactly what's going on the back, okay? All right, I'll start with the wider part, which I'm going to target the lower part of the back. Okay, so what you can do is to find the pressure point. You will know it because it's painful, the most painful part. You know that when you press on it, you feel that the pain radiates somewhere. Because pressure trigger points, now I found the word, trigger points, there is a referred pain into that. So when you're pressing something, it kind of like spreads out somewhere, okay? Pretty much around the area of that knot, okay? So find that, let's say here, a little bit lower, yes. So what I do is I use this hand to kind of like help it steady, and this hand is pretty much like to push this forward, okay? So if I change the angle that way, it's like the pull, the pressure goes a little bit more up. And as I go towards horizontal, this one I feel pushes directly towards my back. And then if I go a little bit down, I feel it's going down as well. Okay. The reason for that is you just have to find exactly how to release it. You have the option to just stay in one spot. Usually I would recommend stay in one spot where you feel that it's kind of like releasing it, okay? All right, so let's find another spot here on the other side. There. You could run through all the way in here, okay? So if I show it to you on the side, all right. So here is my stabilizer. This one is more where I push. You could do both as well, but it's really very good that you stabilize it so that that point, it just stays in that spot and doesn't really go side to side or up and down, or it's a little bit more unstable. Could be painful, I'm telling you. Yeah. And then sometimes I would do as well to run it. So I go from bottom, and then now I could change my hand so I could pull this up. There, pull. There, pull. Now you could use this one with a shirt on, with something that's covering you, or you could also use it like directly into the skin, whichever your preference, okay? Most of the people they have this like anywhere, in the car, in the office. So I would say that they are cloth when they're doing it. And then I use this one as well when I'm in the clinic. So I'd rather have that. There I go, down, down, down. This is really very good to release it on there. Make sure that you don't hit any bone and you don't hit on the spine as well. Could be more sensitive. Now I'm going to show you the narrower one. The narrower one is more on the upper back. You have better control it for the upper back if you use the narrower part. See there? Usually tension is right here at the base of the neck as it connects to the shoulder part. Oh, there it is. Ow. So this one I could play, push it side to side. So I use this hand to kind of like, you know, do a little bit of rocking movement. And then this one is really just pushing it. This one controls, this hand controls how much push I am doing. Okay. All right. Yeah. I wouldn't really recommend this to go here on the neck because it's really hard to control. Okay. It's better for the neck if you can just use your own fingers like this. I think everyone's doing it like this. Or you could do one part to release it. Anywhere that hand can reach, fine. There are just other people who cannot really do external rotation and up, or this one as well. So, but of course, I think the neck, some people have really bad shoulder issues because it's still the same forward head posture. Then it's really hard for them to raise their arm, and it's really hard. So they could use this one. There you go. Ouch. Okay, that would be enough. Now, like I said, you can find this anywhere that sells all about sports, or people who goes into the gym as well. You can find that, or you can find it at Amazon. Like I said, doesn't matter what kind of brand you use. for as long as you know how to do it. Just make sure that when you started doing it, just don't dig in right away. You may feel sore, and when it's really sore, it is really sore. It might prevent you from using your arm for days. So just go easily. So you press it like gently at first, and then you gradually increase the tension. The pressure that you put on the tension of the muscle. Okay? Because the muscle will just, when you dig it in right away, the muscle will actually, respond back and probably will go into the spasm. So if you just gradually release it, the muscle will eventually give in. Okay? That's what I have observed from one of my patients and what I'm doing as well for myself. Okay? Alright, this is called the trigger point releaser. Alright, let's move on, and I'll show you the second tool that I use for myself and for my patients as well in the clinic. So this that fell off earlier, we could change the head part. Okay, so I'm guessing some of you are already familiar with this. We've got other heads. We've got this one. I use this one because it's very soft. I use this one at first just to introduce the treatment to the patients. We have this one here, got 2 points, which I usually go, in between the spine. So the spine is in the middle, and then we go it like on the paraspinals, but that is tricky. I rarely use that one, kind of like a little bit more sensitive. And then we've got this head, which I could go more on the wider part, or you got like more on the muscle bulk, the bigger muscles like the buttocks, the thighs. I like to use this one. Okay, but I'm gonna show you first this one. Gotta make sure it doesn't come off. So there's like a power in here, and then there is a control here from where the power is. You know what? This is easier to. I might not be able to show it to you exactly, but this one is for how fast the percussion could be, and then this one here is just to release it as well. The other box on the other side is just where how much power you have left on the battery. So my observation is that when I do the biggest one, the just number 1, you'll have a bigger percussion, wider and bigger percussion. If I go a little bit higher, then you'll have a bigger, like a faster percussion, and kind of like a little bit narrows. Okay, let me see. Now, because it's really hard to use this for yourself, usually use it for the arms, for the legs, but I use this on the back as well. I just do a little bit more acrobats to it, but this I don't really recommend to my patients, especially when they have like shoulder issues. But I do this to myself. Okay, so do that. Kind of like help with the other hand. Because I already used this for quite some time, so I have a very good holding into it. This is a little bit heavy. Okay, so I could just use that. I could go in here. I could go in here. And just do it like a little bit that way. All right, it's good. We go to number 5. My hair is in the way. Let's see. It's really very good. So go this way and go into the paraspinal as well. I go to the other side. As you can see, I have I can control this very well because I've been using this for quite some time. But probably for you guys, if you're just starting to use this, it could be tiring for the arms because it's heavy. I am not sure with the other, there are very expensive ones, like $400 or something, but don't get that one. It's the same thing, same percussion. So I'm not sure about the cheaper one as well. But for me, as long as it does this thing, works well. What more do you ask? So if I'll just show it to you, this is how it would give you that vibration. Okay? I wouldn't say that you will stay for too long into one spot. I like to move it. And here as well, if I wanted to do the side muscle. Okay, now this one, this is kind of like a little bit hard to look for on Amazon, this head, because I've been recommending this to some of my patients. It's really hard to get this this head for some reason, because this is softer, like I said, because it's introduction. Now if you don't have that, you could start to use this one. It's a little bit not too soft compared to the orange one. Sometimes I use the other hand as well and do a little bit more push. And then I use my body to kind of like release that. I want it a little bit more. Like I said, I've been doing this for a while, so I can take as much as this is really good. So I do the, oh, that's way too high. Okay. Control. There you go. I could go down. If I go to the other side. Oops. Like I said, it's really hard for someone new to use this tool for you, but I'm telling you, as soon as you get the hang of it, this is really worth it. Because, well, if you can do it by yourself, get your wife, your boyfriend, or your kids do it for you. Definitely. My daughter doesn't want to do this to my husband. But yeah, there you go. Okay, since we're talking about here on the neck part, I could use this one, but you know, like I said, be very cautious if you're just new, because this one I can control really well. I go to like 10 or probably 15. This could go as high as 30 in pressure. Then I could do it like this. One of my patients told me that his brain is moving. She told me that we'll probably hold off the massage gun because I feel like my brain is moving. I'm sorry. So I kind of like, okay, was a little bit older, so probably wasn't really used to it. He just wanted my hands to actually release it. So if we just look at it from the front, yeah, I do it like this, I do it like that. Oh, this is really very good. I do it in the front as well. Remember the pectoralis minor I told you about? It could get tight. And sometimes I do a stretch as I use this. There you go. It's really good. I go to the other side. There you go. As you keep on like stretching the muscle, contracting, stretch, contracting, it kind of like removes that buildup of knots anywhere, especially in the pectoralis. You really will have a lot of pressure points in it, and also the upper traps as well. I think I'm not gonna stop doing this, do I? I don't know if you guys already fallen asleep just by looking at me, or like, well, I don't know. But anyway, that's what we call the massage gun. So this is not only just used for the neck, you could use this anywhere of your body. I probably will be using this from time to time depending on where we are with the series that I am showing. The last tool that I've shown to you earlier is the tennis ball. So I already got 2 of those tennis balls and put it on a sock that I don't use anymore. So make sure you don't want to use the socks because it's gonna be like so stretchy. Okay, so I'm gonna use this one to release the muscles here on the base of your, on the like where the hairline is. Probably could go a little bit high up as well and a little bit below, but this would be a very good tool to do it. Okay, so put it flat here. Not sure. Okay, flat here. And then I'm just gonna have to, okay, first, I'm not sure if you're gonna see my legs, but I am bending it like flat on the floor. I just want to show it to you a little bit closer. So I put this on the base of my base of my neck, base of my head, where the hairline is. You could feel it. Just by doing this one, it's already releasing to some, but others probably may not feel any release to it. So you could do the chin tuck. Remember the exercise, the chin tuck that I told you about? You could do that. And then you could really feel that it's releasing. Probably you feel a little bit more pain here, a little pain here, or pain on the back of the head, because you've got muscles in there. You've got muscles in here too. Your occipitofrontalis, temporalis, and right here, still part of the occipitofrontalis. Okay, so what I do chin tucks, kind of like move, a little bit of head extension as well. And then just kind of like roll that tennis balls on the neck. Make sure that the bone, the spine, is in between the 2 tennis balls, okay? Because you don't want to hit that spine. It's gonna be so painful to some, okay? And you're not supposed to like push that spine though. It will be like the muscles in between the spine. You could also hold it with your hand. Just gauge it. You know, you could use the hand to kind of like keep the ball steady, and just use your hand to do chin tuck and then head extension. I could move it a little bit on like lower 1/3 of my head, because that is also like painful to some. Oh, it's really very good release. And then you could do it this way, right? And then do it this way. Okay, well, I'm gonna show it to you like this. From here, you're just doing it like this: chin tuck, extension, chin tuck, extension. So this ball is rolling from here to here, here. Okay, or you could just simply put that ball in there, okay? And you could put it a little bit lower as well. This one is for the base of the neck. It could be a little bit sensitive though, because this might really like be pushing into the spine itself. So just do it like in the middle of that neck part. This is already very good. It feels really good. Okay. Now, the other one you could use to release the tension on the upper back. Whatever there. And then just have to lie on it. Ooh, like I said, make sure you're not hitting the bone. Let me just go a little bit down. Okay, there. Like good. Put the ball exactly where I feel the tension. Now I would really recommend that you're not bend your knee. If you're gonna go a little bit straighter, it might be too much for your back. Okay, so you kind of like control it with your knees, with your legs bending. So from there, you could find that pressure point. Stay there. Then you can arch your back and you gradually push that part, gradually, slowly, until you release that muscle. Okay, you could go a little bit down as well. You roll it down. This is a lot of control, I'm telling you. It's gonna be too painful probably for people who are stocky. Not really stocky, like, you know, you have an excess weight in here, because it's kind of like hard to control. This is a whole lot control of your abdominals as well, because it's not just only arching the back and pushing it down. If you don't have enough core strength, you probably might find it too difficult. It takes a lot of practice, because if you're a little bit heavier on this part in here, it's gonna push that you know, the pressure or tension on your back, and if you don't have enough control over it, it's gonna be painful. So careful on this one. This is just a demonstration to you, but you need to have at least someone to help you get up, just in case if you need to get up, or just kind of like whoa. Okay, so this you could roll this in here. Now you could, I'm not just going to change position. You could use this ball as well against the wall. It's the same idea. Put this against the wall. You will push this bone when you are standing. Okay, so you could use not just the tennis balls. I just used an example as the tennis balls, but you could use whatever you can find at home. You could also use the softer ones, the one that I showed you from before, the sensory balls toys that I used to release on that plantar fascia. Okay, so I guess that's kind of like there are other tools as well that I use, but those three are the most ones. I probably, when I have time, showed you the suction cups, but that will be in a later time. Because that's a lot of explanation in there. Okay, so the next session would probably be some exercises again that targets postural exercises. So for now, thank you very much for watching, and please don't forget to subscribe. Bye for now.